Welcome back to West Texas View.
Welcome back to the West Texas View. We've been talking with Dr. Bobby Jane, who is a psychiatrist, teaches at the Texas Tech Med School, and also is in private practice at the Tech Clinic. And we were talking about children sharing their parents' bed. But let's move on to another area and talk about before the child comes, because there's so many things that happen during a woman's pregnancy that can cause some real upheavals. Of course, all the hormones are going on, but the depression after miscarriage is one of the things that we get a lot of questions after you were here before.
Right.
And so talk about that a little bit.
Right. This is something very unfortunate that happens in a woman's life. We do know that the woman, the bonding between a child and the mother does not start
after they're born.
After they're born. The very start, the moment the woman realizes she's pregnant, the bond starts there. She doesn't have to
Patting
feel
her stomach.
Right. She doesn't have to feel the child kicking around. The very fact this is just nature. This is how the instinct goes.
I know something's growing inside
Right,
me,
exactly.
and it's going to be my child.
Right, and that attachment happens. But to lose a child at any stage during the pregnancy, of course, it's more difficult when later the pregnancy progresses. The loss of a child during the later period is more significant compared to, say, early loss of pregnancy. But this is something very, very important. We used to think that this is just an adjustment thing that women go through, but there are a number of studies have been done to find out that the number of miscarriages a woman has, the number of pregnancies she loses, the more difficult is for her to get emotionally well. In other words, depression tends to be more significant.
It accumulates.
It's an accumulating factor that if you have more losses of pregnancy. So someone who is very susceptible to depression or is already struggling with depression would be probably more susceptible to develop this kind of severe depression. So what we're talking about, that these kind of women tend to have the number of things what we can do, of course, for the loss of pregnancy. A lot of times, families and other people dismiss this, that this was not a child, they were just clumps of cells, or there was no heartbeat in the child. But for mother, it's very real. So a number of rituals can help in that. What I recommend to my patient, in fact, I do have a couple of patients in my practice who are going through the same process, and I'll share with you what has been helpful in their cases. And I would recommend them that even though the child was not born, you name the child. In fact, most mothers have already got a name to them. Maybe come up with a picture of it, or imaginary picture of what the child would be. If they wanted, most women will say that they felt it was a boy or a girl, and that doesn't really matter to me as long as they have a mental picture of it. And I do recommend that.
And a mental picture of them holding it.
Holding them, yes, absolutely, absolutely. And also recommend that you write a very long, loving goodbye letter to them. And with that letter and with some of the things that you may have done for the pregnancy, a lot of times they accumulate like small toys or small socks and things like that. You collect it and make almost like a small burial. Maybe it's a shoebox or something like that, and do a ceremonial burying. So it's kind of coming to a closure of it. Because for a mother, women who will tell you, even though they have multiple children after that, living children, and it's being like 50, 60 years, they still miss the children. I'll give you from one example. My grandmother, before my mother was born, lost twins. And we are talking about, my mother is 71, so this was older than that, so it's about almost a century ago. And my grandmother died about 25 years ago. So my mother says that my grandmother, until she died, still she'll talk about those, and they were never born live, they were just early miscarriages. So what I'm trying to point out, for the mother, it's a still very real and very real sensation about loss, and that needs to be acknowledged. There are a number of support groups also available I'm not sure if they're in the Midland area, but if you're looking at the extended area.
But this is what most people say is, oh, God meant for this to happen,
Right.
or just lighten up. Now, you've got to get hold of yourself. And
Yeah.
those kinds of
Things don't help.
admonitions don't help.
Don't help. And the worst thing the mother hears is that, oh, you're young, you're going to have other
Yeah.
pregnancies. No, each pregnancy is very unique. Each child is very unique to the mother. And of course, she may have more children, but that child she lost is probably more precious to her because she never got to hold. And there's also sometimes guilt with it. So to a psychiatrist, psychologist, you really want to address the guilt associated with it. I could have done this, I could have done that. But that's what the nature is. I mean,
Well, but you know, the thing that bothers me most about this is that how do you ever get to them? Because are they referred to you by their obstetrician who says this? I am seeing signs of depression.
right.
With this mother who lost her
Right,
children.
right.
Because you very seldom have a mother that recognizes this in herself.
Right. And that's one I exactly have it. I'm happy to say that the patient I'm talking about, she actually conceived again and actually had a live birth afterwards. But the pain of the old pregnancy is still there. So again, at what time should you seek psychiatric help if you're going through it? And the thing is that if the sorrow continues beyond a period of time which you think is unreasonable, and normal can be, it's very vague. Some people for 2 months, 6 months, depends on a lot of different factors. But if it consistently gets worse or it doesn't get better, or you start having social withdrawal, or you withdraw things, you don't like to do things which you used to like to do before, your social activities.
Or that just pervades all of your life.
Or it's something that constantly on their minds. They cannot function well. They're not able to take care of their everyday duties, be at work, be at taking care of their family duties, having trouble with sleep, constant tearfulness, not able to function well.
Do you find that the older a woman is when she has miscarriage, the harder it is for her to get over
I
it?
think it's true, though I can't cite any particular research associated with it, but it's difficult for older women to lose a child and get over it quickly.
Especially if she's not had any before.
Particularly, exactly, because then the sense of urgency comes in that, okay, I'm getting old, this could have been my last chance, and things like that. And again, you really want to encourage the parent to, again, celebrate their birthdays, the so-called birthdays, when the time they expect to do it, and treat them like real living human beings and keep their memories alive. That helps to get over the loss.
Yeah. We're going to have to close this program today, but one of the things I want to encourage you to do is to tune in next Sunday, because we're going to continue these conversations on several topics that our viewers have told us are really important to them. And it's such a joy to have Dr. Jane here, because his time is really valuable. There's not enough psychiatrists to go around in the United States, and particularly in the Permian Basin. So for him to take time out and come to the TV station and do these programs is really something that I treasure and appreciate. So we'll see you next Sunday with another program, and we'll welcome Dr. Jane back.
Thank you.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB TV and KWES TV.